tight hips. We're going to show you how to mobilize with
Mm.
advanced tech. Today's video is based solely on this book, Becoming a Supple Leopard. It's by Dr. Kelly Starrett. He's actually going to be on our podcast at the end of the month.
It's a big deal.
Very, it just changes my thinking about so many things.
Sure.
Lifting correctly, it's
Body
actually
mechanics.
body mechanics. It's definitely if you're a lifter, but if you're elderly and you want to learn to get your body supple again. Some of these things, especially those mobilizations, I don't want you doing if you have rheumatoid arthritis or if you have loose joints, like if you're double jointed.
Hypermold, if your hip clunks and you hear it snapping a lot because it's loose.
Yeah. Or if you have a hip replacement, obviously. This is where the ProPod can actually come in handy. So he has a technique he calls smash. Basically,
smash.
Yep, you're smashing into the muscle. Sit right on this. Don't sit on the sit bones, but right around it.
So you're getting the muscle.
Yep, you're putting pressure right on the muscle.
If you don't have one of these,
you can use a lacrosse ball. You can use a tennis ball. Might not work as well because you gotta have something fairly hard.
When you find a tight spot or a knotty spot, that's probably going to be a little more painful, and you're going to have back off on the pressure.
Well, right now, if you have pain, that's a problem area.
Okay.
Smashing the muscle, but then you're flossing. When flossing means movement, we use flossing with like the sciatic nerve. And what I'm going to do is I'm going to work on the hamstring now. I should be on a hard surface. I'm going to put right on the hamstring, and then I'm going to lean on it, and then I'm going to go ahead and floss at the same time.
Firm chair.
Yeah, firm chair.
Yeah, and you can feel that muscle have that kind of a massage, so to speak.
Yeah, if it's bound down, again, you want to find the spots that are actually tender. Next one is called tack and twist, and now he does this with a lacrosse ball. Pushes it in and twists it.
Yeah.
Pushes it in and twists it. This works really well for this because it's got a little texture on it. I've been using it on my hip adductors.
So that actually gives a little massage with that twist and grabs a hold of the skin.
Well, it helps loosen, the muscles are supposed to glide over the surfaces underneath.
Right.
And if they're not gliding, they're bound down. Pressure on one side. I'm going to stretch this side.
You may want to put it on your knee on a pillow if it's a hard floor.
Right. And what you're going to do is you're going to lean over onto that side. And like I said, you're trying to almost pop the hip leaning on this side.
So right here, this is the stretch area.
Yep. Now, again, obviously you want to do this with a total hip or if you have really loose hips, because I don't want somebody's hip to dislocate.
Yes.
And
this is a loop stretch band that...
this works great for mobilization.
Yeah.
And it's
stretchy.
Yep, and it's hooked up to a wall anchor here. And it's set the way it comes. These hook up to the wall anchor quite nice, actually.
Yep, right here.
So I'm going to go like this, and now I'm going to do the same thing. I'm actually going to go further out, and I'm going to bend over like that, and it pulls it a little bit while I'm doing this.
So you need to do this with something stretchy.
Now you can actually work on internal rotation, and he actually puts a weight sometimes here, Brad, so you can't internally,
so something here. So you move the ankle this way, internally rotates the femur, changes the emphasis of the stretch.
And then you can do external rotation too, which you don't need to do, Brad. You have plenty.
Yeah.
So it's the same thing. You're going to externally rotate the leg and bring it on over.
So the band is pulling the femur this way. You're leaning over.
Trying to get more flexion
of
the hip.
So these should not be painful, right, Bob?
No.
You should feel a stretch.
Yep.
But not a painful stretch. Certainly no sharp pains.
What Kelly says is he actually says, stay out of the pain cave.
The pain cave?
Yeah, don't go into the pain cave.
Right.